Hi there, my name is Joanne Finnegan and I am a one of the founders of Ocular Melanoma Ireland, and it is a patient and caregiver support and advocacy group which was established in 2016. And today I'm going to talk to you about, as a caregiver and advocate in relation to ocular melanoma, which, as we all know, is a rare cancer. I'm specifically going to talk about access to treatments abroad from my experience, and I'll also talk very briefly about clinical trials and accessing clinical trials within the EU, and that would include the UK at the time, but as we know that due to Brexit, there could be changes afoot. However, there is no changes with Ireland and the UK at the moment because we do have a common travel agreement. So hopefully that is going to stay. This is a photo that I decided to put up because it's where I'm from, where my dad Liam lived and the family live, and that's Clontarf in Dublin, Ireland. And he was a very fit man. He loved to run, he loved triathlon, swimming, and this is a place where he liked to walk and to run and walk. So I just wanted to put that up. Here he is doing what he did best. He has a cutthroat razor there, and he's giving his customer a very close shave. And this was actually after his enucleation, and it was after some treatment, and the treatment that he had was Delcath, which I'm going to go on and talk about. So I just wanted to put that there because even without his, eye, only having one eye, he never really had issues with his sight at all. So people are different, but Liam didn't have any warning signs. He had no symptoms, and he was actually just attending the Mater Hospital as a type 1 diabetic, and he was attending the eye clinic there on a regular basis. He was actually diagnosed in the private section, and the reason for that was there was a delay. There was a lot of waiting. There was a long waiting list at the time on the public system, so he transferred over to the private system. He met Paul O'Connell there, and he diagnosed him, unfortunately, with a very large ciliocoroidal ocular melanoma, obviously at the back of the eye, which this is obviously new to us. Never heard about, cancer, melanoma in the eye. Everything happened really quickly. There was a referral on to Mr. Noel Horgan in the RVEEH, and he recommended that because it was so large, couldn't do radiation, there was no other treatment that could be done other than remove the eye. So I think it was 2 weeks later, he got the eye removed, and following that, I think that in itself was it was difficult psychologically for him and for everybody else in the family. So following on from that, we then realized that he had to go for surveillance, and was sort of bit by bit, we were learning that there was more to it. It wasn't just the removal of the eye. So the surveillance scanning meant that he had to go and see an oncologist. So he went to an oncologist in the Mater Hospital. That's where he was referred to. And again, very unfortunate for him, the first scan showed 3 liver tumours. I want to say as well, before he went to his oncologist, the tissue from the eye went to Susan Kennedy here in Dublin, and then it went on from her lab over to Sarah Coupland's lab in Liverpool. And over in Liverpool, they did a genetic test, and the genetic test did come back that it was a high risk of spreading. Now, that information didn't, I suppose we didn't really take that in, what was happening at the time, but there was a very high risk. So when Liam went in to get the result of this scan, myself and my mum were there, the oncologist was there, and his understudy was there as well, the reg, and they basically said that there was no options around resecting the tumours, and he was going to be referred to hospice. However, some people, it seemed, did well on an immunotherapy called ipilimumab. So that was just the single immunotherapy at the time. And I just want to let you know that was going back to January 2016, so that's a while back. Things have progressed from then. So that was the state of play, that some people did well on ipilimumab, and he had one infusion in February, so he started on that. In the meantime, then I got started on some research, and I met Brendan Lynch. Brendan Lynch is one of our founding members. His wife Belinda underwent DELCAT treatment, which is the liver-directed treatment, and she did that in the Spire in Southampton. So otherwise known as chemosaturation with percutaneous hepatic perfusion. That's high doses of chemo directly into the liver, and therefore limiting toxicity. So we did do a good bit of research, as much as we possibly could, about that. Liam got all the information, and he realised that the immunotherapy had only a 2 to 5% chance of working. So he decided to take a risk and to go and visit Southampton. The medical team over there were happy to have him, but they needed a referral. Very unfortunate that the oncologist that Liam was seeing in the matter didn't feel it was the right option. He felt that this was an experimental treatment, and therefore declined a referral over. In saying all of that, we were again lucky, because Mr. Noel Horgan agreed to make the referral over. So got over to see the team, the multidisciplinary team over there, and just really happy with the team straight away. Felt safe, secure. Information was being shared with us, and Liam felt that this was going to be the right road. He felt that the team were very professional, and he knew that they were world renowned in what they did. So I'm just going to give you a little timeline in relation to the DELCAT treatment, which was overseen by the interventional radiologist Brian Steadman, who is, I think, talking here over the next day or so. So his first DELCAT was the 1st of March 2016. He then went on to have 3 more, and he had a complete response. So as we know, NED, that people use on Facebook all the time, no evidence of disease was found on after the 4th of November 2016. He did, however, it did go on to progress on the 7th of the 11th, 2017. It did begin to grow again in the liver. And he was seeing at that time, then we found a really, really good, excellent oncologist in Vincent's Hospital, Dr. Giuseppe Gullo, who really looked after Liam really well, and they had a very good relationship, which is important to have a good relationship with the oncologist, and a lot of patients will know. So he was very happy to refer him back over again. So indeed, he went over for 3 more DELCATs, January 2018, March, and then June 2018 was the final one, because unfortunately it did progress. In fact, it did progress around March. It moved, or not moved, but it appeared in the lung. So we knew we were getting to the end of the DELCAT treatments. Even though it was working in the liver, it was popping up elsewhere. So we had to then decide what else was out there, and looked at the IMCGP100 trial, and I'm going to talk about that a little bit later. So how did we actually pay for this treatment, which comes in, I think it comes in at about 50,000 euros. So a costly treatment if you're going to pay for it privately. Luckily enough, we were able to access the Treatment Abroad scheme under European legislation. And that is the map there of the European Economic Area. It's including Iceland and Switzerland as well. So these particular countries have an agreement for cross-border travel. But I just want to note there that, you know, I guess when you become unwell, you become sick, the last thing you want to do is travel outside of your own country. You want to stay in your own jurisdiction. So it's not something that you want to be doing, you want to be applying for. So I think patients need to be facilitated sensitively in relation to the travel. So healthcare within the EU, EEA, as an Irish resident. So there's two different schemes. There's the cross-border directive, and that's for treatments that are available in Ireland, but there might be a waiting list. So for example, if somebody is waiting on hip replacement and there's long waiting lists, and you do your research and you find that there's somewhere elsewhere in the European Union and the waiting list isn't as long, you can then go and access the treatment there, or the operation there. So what applied to us, what applied to Liam, was the treatment abroad scheme, otherwise known as TAS, and that is for for Ireland, for where there is no treatment available, where there's a better treatment available elsewhere in the EU and the UK. I'm adding the UK into that. So there is criteria. There's an application form that needs to be made. The patient, there's a part for the patient to complete and also for the consultant. So I'm just going to read through a little bit briefly of the criteria that I feel that if anybody is applying for this, to note. The referral needs to be from a consultant, not from the GP. The referral must be made within a 2-week period of having seen the patient. The receiving hospital, so for us that was the Spire Southampton, must accept the E112 form. The valid application, when it does go into the treatment abroad scheme office here in Kilkenny, takes 15 to 20 working days to process. The applicant patient ensures the application form and consultant's referring letter is also sent in. The onus is on the patient to ensure the application is fully completed. The consultant must send a copy of the referring letter to the accepting consultant. The application must be fully completed or will be returned. The decision is received to the patient, and indeed Liam got his decision by letter. All paperwork must be sent into the TAS office at the same time. So what that means is that the consultant's referral letter must go in with the application, or it'll be sent back, and then you've got delays, and we all know we don't have the time for delays. Also in Ireland we have a private system and we have a public system, hospitals, and if you are a private patient, it does state for patients with private health insurance, the application should be made to their provider in the first instance, and the decision letter accompanied with the application to the TAS office. So I guess if, for example, you've got Bupa, you make an application to Bupa. If they decline, you then bring that declining letter to TAS with your application, and you can therefore make the application. There's also national travel policy included with this legislation, and it allows for airfares to be reimbursed for the patient and for one escort. So that was for my mother and father. So I just want to say, I want to talk a little bit about clinical trials, because we did try and access, my dad did try and access the IMCGP100 trial in England. So you need a referral. So you need to discuss that with your oncologist, and he or she will discuss it with the team as to whether it's going to be appropriate for you or not. You need to think about the phase that the clinical trial is at. There is eligibility criteria, there's inclusion and exclusion criteria, there's the cost of travel, there's the overall cost of just being, not working. If a family member is going with you, that person needs to take time off work. What supports do you have? Do you have somebody to go with you, to be with you while you're there? And also psychologically, obviously, it's not just a physical thing. Psychologically and emotionally, it can be difficult when you're outside of your own place. So Liam tried to access the IMCGP100. In the first instance, what he had to do, which is still the case now, he had to go for the HLA test, and that was done in Vincent's Hospital, and he was positive for that, which was a start in the right direction, a move in the right direction. I found that the centres at the time were Mount Vernon, and then there was Clatterbridge. So Mount Vernon, they were really, really strict with their, I suppose, their insistence that they could not facilitate an Irish resident, and they said that Liam had to be eligible for NHS treatment. So that was fair enough, because there's nothing legal in place. Clatterbridge, on the other hand, under Dr. Seiko, was just completely the opposite. They accepted him for assessment. Dr. Seiko emailed and phoned and gave us quite a lot of information. We also talked to other people that were on the trial through the Facebook group, which was really, really good. And we went over in August 2018. So just keep in mind that Liam's last DELCATH was June 2018, so we had to move pretty fast. It was unfortunate. He did go for imaging. Everything seemed fine. Everything was doing well, but his lymphocyte count was low, and therefore he just couldn't be accepted because of that. So that was a difficult time to realize that there was nothing else happening for him. So clinical trials, because there's no proven effective treatment for metastatic ocular melanoma, I suppose it's, the reality is that most patients will try and access trials aiming to extend their life. In effect, many are in desperation. They're in, situations which, it is desperate trying to find something. And due to the rarity of ocular melanoma, it means we are in particular need for treatment options cross-border. The EU directive, which I spoke about earlier on, to access treatments that are like DELCATH, does not clarify the cross-border access when it comes to clinical trials. So there's no legislation in place. And so it's quite ad hoc whether you would access like we experienced. EU member states must be encouraged, as there is no legal obligation to enable solutions such as that evident in the Nordic countries or between border regions of Germany and the Netherlands. And also, we need to think about, is the political will there to actually assist patients with this rare cancer? So there are huge inconsistencies and inequalities across the EU when it comes to cross-border access to clinical trials, we have found. And just to note that patients living particularly in the small European countries such as Ireland, where we have no clinical trials, clearly because we have a very small population and we would not have the expertise as yet, and there is no legal directive allowing cross-border access at this time. Not being able to access a clinical trial does not just mean that one cannot partake in research, but one is ultimately denied access to potential effective treatment to extend their lives. And I think that's really important to consider. So that is it for my talk. I want to say Gur Míle Maith to everybody, to the patients, researchers, clinicians, to Liana, to Lauren, and everybody that invited ocular melanoma to be represented at this global event. Thank you so much, and we're delighted to have been here. Thank you.
Hi, my name is Pádraig Rogan. When Joanne asked me to speak about my experience with ocular melanoma, I immediately said yes. And then I thought about it and realized that was definitely the wrong order in which to do things. However, having thought about it, I've come up with a few things that hopefully you'll find, if not informative, at least a little bit interesting. First things first, I'm way out of my comfort zone here on video. There's no way I'll get everything done in one take, so expect a few cuts, apologies for those. And I may attempt to put some pictures or other things in for context, but I have no idea where, so that would be a surprise for both you and for me. So back to the matter at hand, I guess. As I said, my name is Pádraig, and in the summer of 2017, I was scratching my head at work, which would not be an unusual occurrence, and covered my right eye and noticed that I couldn't read the monitor, which was somewhat unusual. I booked an appointment with my optometrist, figuring, I'm a bit young to be needing reading glasses at age 30, but these things happen. And it was really when she shone the light in the back of my eye and recoiled that I figured, okay, well, something is probably wrong here. She whipped out an Amsler grid, which is basically a number square without the numbers. And the whole bottom corner was like a lava lamp swirling in waves, a real 60s psychedelic vibe. So something was definitely amiss. She sent me to William Power in Blackrock. I'd had laser eye surgery with him about 6 years prior. And he immediately concluded, he took some pictures and scans and pretty much immediately concluded something was not right. But as the way I like to think about it, he's the front of eye guy, and Mr. Noel Horgan is the back of eye guy. So I got referred on to Noel Horgan. In a path that will be very familiar to the Irish patients, I guess, who are listening, Noel diagnosed me with a choroidal melanoma, about 4 millimeters thick, and very shortly afterward, I was into St. Luke's in Rathgar for plaque brachytherapy, 4 days with the ruthenium plaque in, and subsequently removed alongside a biopsy. From there, I underwent surveillance under Professor John Crown in Vincent's, undergoing regular 6-month MRIs. So all was going well. Scans were clear, which was great news. And I strode in with some confidence into a routine follow-up appointment in October 2018 with Noel, where he discovered significant regrowth of the primary tumour. So between us then, we decided that the best path forward was enucleation. And again, no hanging about, as would be familiar to the majority of the Irish patients. And once the wheels are in motion, it happens pretty quickly. And within a week, I was into the Royal Victoria Eye and Ear Hospital to have my eye removed. So I suppose I'd like to pause it there for a second. I feel like when you look at the simple timeline, it paints a really good picture about what happened to me physically. I've had symptoms. They've been diagnosed. In short order, I've had treatment, 4 or 5 days. I've gone through a recovery period, 4 or 5 weeks. Then in a routine follow-up, my recurrence has been diagnosed. It's been treated, another 1 or 2 days in the hospital, and again, a 4 or 5 week recovery period. But I feel like that timeline, while it paints a really good picture about what happened physically, doesn't accurately describe what's happened to me emotionally or the impact that this diagnosis has had on my life. So to put that in context, I guess I need to give a little bit more background about me and who I am. I come from a very musical family in which I was the odd one out. I was obsessed with numbers as a child. Ended up studying finance and actuarial math in Dublin City University, where I would have covered topics like probability, risk, mortality. And then moving on, I got a job in a trading company whose European headquarters is based here out of Dublin, where I've traded volatility derivatives for the last 5 years. So effectively, every day in work for the last 12 years, I've gone in, evaluated, analysed, and priced risk. So you can imagine my reaction then when I got diagnosed with ocular melanoma. I wanted to quantify the risk. I'm sure everyone's heard of Dr. Google. Well, I had him on retainer. Any publication, any paper, anything at all that I could get my hands on in relation to OM, I consumed. I was obsessive about it. And why was that? Because I was afraid. I think when you see the statistics, when you see that 50% of people who get diagnosed with ocular melanoma will eventually succumb as a result of the disease, that's terrifying. It's really, really frightening. For me, as a young man, I was thinking about starting a family, and this diagnosis, has huge ramifications potentially, for the direction that my life is going to take. So it was a huge amount to process. And while Dr. Google is great at telling you, what to expect with regards to, the physical symptoms of your disease, and certainly it is right to be informed and a very necessary thing to be informed as a patient, it again does not do a great job at letting you know the emotional impact an OM diagnosis is going to have on you. So what specifically, I guess, do I mean by emotional impact? Am I being dramatic in that sense? And I really don't feel that I am. I think first and foremost, I mentioned the 50% statistic. It's that fear of death, effectively. That all of a sudden was not present, that now is there in the back of your mind. Quite often. It's the anger when you're waiting for these biopsy results that will come back, and 6 weeks pass, 8 weeks pass, 10 weeks pass, and you still don't have them. And these are, hugely important, or for me, certainly I had put huge weight on how important these results were in telling me about, my likelihood of survival, and, I could ream off probability statistics. And then when they were delayed, I'd be so angry. And then when they came back inconclusive, I was absolutely devastated. I really had set it up. I put them out there. This was going to be the thing. I was going to get these results, and they were going to come back one way or another, but at least I'd have certainty. But then I didn't, and I potentially would never have it. And trying to, come to terms with that, incredibly difficult. I had to tell my mum, who'd lost her husband and my dad 18 months prior, that we had to cancel a family holiday that we had planned. We were going to do Route 66 in the US. And instead I had to go to her and tell her, no, your son is going to spend that time in Luke's in Rathgar instead, having radiotherapy because he has cancer. The weight of that conversation, was so difficult. I remember driving at night for one of the first times and getting a fright, a car coming out of nowhere, and just realizing I'd never be, totally comfortable behind the wheel again. I think that had an impact on me. The rejection of not being able to get a mortgage because I couldn't get life cover. Feeling like I couldn't move on in my life, even though I'd had my diagnosis and had my treatment and thought I was free of this cancer. No, it came back to bite me again. After the brachytherapy, the slow, gradual decline in the vision in one of my eyes, every day a reminder as the radiation, started to bite on my vision. And of course, the hammer blow that was hearing that the cancer was back and not knowing what that meant for my chances of getting metastases. But knowing, so no certainty there, but knowing with certainty that, it would affect my appearance forever, that I was going to lose my eye. So how did I deal with all of these things? Well, unfortunately, I already had some experience of these emotional earthquakes, as I like to call them. In 2015, 3 days after Christmas, my dad had a huge heart attack at age 58 and passed away. It was a total shock to me, my mom, my brother. I hadn't been sick, didn't smoke, didn't drink. His cholesterol had been absolutely fine in a routine checkup a couple of months prior. But, he was gone. And I remember for quite a time after, I was so angry about it. I was just, short-tempered and quick to rise. And it was funny, I actually went to my barber and to get a haircut a couple of months after, and he'd asked me how my Christmas had gone, and I'd said, well, it'd been terrible, been absolutely awful, and told him what had happened, and he kind of empathized and said he'd been in a similar situation and that he'd gone to a grief counsellor and found it hugely beneficial. So, who am I to not take the advice of my barber? And I got home and I said, you know what, I'll give this a go. It wasn't something I'd really considered before, but when it came from such an unlikely source, I said, maybe it's worth it. So I tried it and found a counsellor, and to my surprise and pleasure, I guess, it really worked. I found it hugely beneficial, and it helped me get my head straight and figure things out, and I was able to see things from more perspectives, and it really worked for me. So then I guess when I got an ocular melanoma diagnosis, I rang up my counsellor again and said, are you free for some sessions? And now I go every 3 weeks, and I really get a huge amount out of it. I would highly recommend it. Similarly, we did the Thrive and Survive workshops. They were organised by the Royal Victoria Eye and Ear Hospital. A chance to meet other patients and go through a set course. People who've had a similar experience to myself. And I really got huge benefit out of it. I really thought it was very worthwhile. And of course, I can't not mention Ocular Melanoma Ireland, who do absolutely fantastic work through their Facebook group offering support, and also, of course, through the meetups. There are now Zoom meetups more than physical in this COVID world. But, again, another outlet to discuss common themes and common feelings, which, I find hugely beneficial. So to finish up, I'm going to be brazen enough to offer you some advice. While I realize I'm totally unqualified to be giving anyone advice, I'm going to do it anyway. I feel like I've picked up one or two things, and if you're not in the market for unsolicited advice, just skip right to the end. The first is try and be positive. When I was going to Luke's, made me really realize in some ways how lucky I was. The guys there undergoing 10 weeks radiation treatment for esophageal cancers. I was in and out under general anesthetic in 45 minutes and spent four days on Netflix. It really wasn't so bad. Of course, you're unfortunate to get the disease, but in the grand scheme of things, it's manageable. Similarly, when I lost my eye, I was amazed that I'm still able to do so many of the things that I could do before, and still I'm privileged and lucky to have the job that I love, a family around me who I love, and even moving away from OM for a moment. I lost my dad at 28 and made me so angry at the time. But now looking back, you realize, well, I had 28 years with, a loving and caring dad, a house filled with laughter and joy and music every day. There's so many people never lucky enough to experience that. So I think flipping the mindset around can really help, appreciate what you have. The second thing I would recommend, I guess, and as someone who's socially awkward, maybe this was a little bit easier for me, but try and give people the benefit of the doubt. I think you're going to have friends and family say the most idiotic things to you, moronic. You're going to wonder, have their brains been replaced with scrambled egg because of the inappropriate things that some people are going to say to you. But I found, if you kind of realize, certainly me, I find it really awkward, at funerals or speaking to people who are sick. It's like a nightmare for me. So when I put myself in their shoes, all of a sudden I found it a little easier. And I found generally, if I give them the benefit of the doubt here, take what they've said in the kindest possible sense, that, it made things run a little smoother. Everyone's just trying their best. They're going to say the wrong thing from time to time. And, even though you may want to strangle them, generally it's best just to let it go. The third thing I want to say, and I really can't stress this enough, is, talk to someone. Be it a professional, be it a close friend or family, or, a patient group. And there's so many of them out there, and they're great. The diagnosis with ocular melanoma carries huge emotional weight, and just like any weight, in my opinion, if you try and move it yourself, yeah, okay, you might succeed, but you're very liable to injure yourself. If you can reach out and share that burden amongst a few more people, it's going to be significantly easier to shift. And certainly in my experience, I found it hugely beneficial. Finally, give yourself some credit. I think an OM diagnosis is really hard. It's really tough. You're going to go through the mill. You're going to go through a gambit of emotions. You're going to have good days and bad days, steps forward and steps back. And I think, while some of us unfortunately will succumb physically to the disease, there's not one person who gets this disease who won't get stronger mentally and emotionally, because you have no choice. You have to. As someone who is diagnosed with OM, I guarantee you are going to be far more resilient as a result. As for me, in 2019, I got married to the lovely Hannah. I must thank her for all her support. I'm not going to say that I couldn't have done it alone, because I know there are many of you out there who are and can do it alone, but certainly it made it so much easier to have her support there and have her beside me at the different doctors' meetings and all of that. And even though it was tough on both of us, you know, I really truly appreciate all that she's done. And then last March, and I'm unashamedly going to be sticking a photo up here, we welcomed baby Jack into the world, and I am an insufferably proud dad, and I'm showing him off everywhere I go. So now I found a new audience with whom to share some more pictures. So there you go. Enjoy that, and thank you very much for listening, and enjoy the rest of the conference.
Hello everyone, my name is Chloé Le Bonnois. I'm French, and I'm actually not the patient but the caregiver for my dad, who was diagnosed with choroidal melanoma in 2017. Since then, it's been a long journey and quite hard, to be honest, so trying to make a long story short. He was treated by proton beam therapy, which is the treatment mostly used in France since many years now, and he was treated at l'Institut Curie, which is the reference center in France. The treatment was good and effective on him, despite some side effects. He slowly lost his sight also within 18 months after the treatment. We got informed at that time by the ophthalmologist team and by an oncologist about the risk of metastasis, but without any specific info and details about the case of my dad. So the surveillance checkup given by them was a liver ultrasound every 6 months only. Thankfully, I did research. I heard about the class of risk, how to determine it when the biopsy could not be done, as often it can't be done due to the location of the tumor in the eye. And so I made sure that finally my dad was having an MRI with and without contrast every 3 months. Unfortunately, 16 months later only, the MRI images had shown a nodule of 10 mm. So the oncologist in the hospital advised us to confirm by a PET CT, which we did immediately, and the PET CT didn't show any nodule, any tumor. So the radiologist and oncologist there told us that my dad was clear, nothing to worry about, just to plan one more checkup 3 months later. But I was not at all comfortable with this idea. I couldn't understand how the MRI could clearly show a nodule where the PET scan didn't, and how we were not searching more about it. So I called again l'Institut Curie in Paris to get an appointment with an OMM specialist. And what a shock to realize that they could give us an appointment only a month later. I always heard that sooner we detect mets, better it is. Sooner we start treatments, better it is also. We all know that cancer is a race against time. At that time, I was still living in India, New Delhi, and my dad had a trip planned for holidays, so we decided that he should still come while waiting for the appointment in Paris. I know a lot of doctors in India, and especially one very good oncologist, so we asked him an appointment to speak about it. And when we have shown him the images of the MRI, he at once said that for him 99% it was melanoma mets, so he straight sent my dad for an ultrasound where we could find the tumor, and they did a biopsy immediately. After 3 days only, we had the confirmation that it was OMM. So we asked to this oncologist what would be the plan according to him for my dad, and he advised us to start by a laparoscopy to really see the liver, and if only one met was there, or maybe even 2, 3, but where located, a resection could be possible, and it would be the best option for the first-line treatment. Meanwhile, we went back to France for the appointment we had at l'Institut Curie to see the OMM specialist, and it was the hardest appointment I had in my entire life. The doctor was so rude. She straight told my dad that he had between 3 to 6 months left in front of him maximum, that he had a very aggressive form of OMM, and that nothing could be done. I don't even know how a doctor could speak this way. She was really inhuman. She didn't want to speak more. She didn't want to explain nicely anything to us. So as I did researches before, I asked her about loco-regional treatment, about resection, about immunotherapy, but she explained me that as there was no cure for this disease today, in l'Institut Curie, they don't do any loco-regional treatment. Immunotherapy was not an option for him, and that she could propose us only a chemo, dacarbazine drug, which is very known not to work for OMM, and it was the only option she could give us. We were honestly very traumatized, and we didn't know what to do. So we finally decided to go back to India at once and to go for the laparoscopy to see if resection was possible or not. My dad went for laparoscopy quickly, and our first big disappointment when we got to know that the resection was not possible. His liver was actually already with multiple tiny mets. It was papered with mets on both lobes. So, like it happens on OMM sometimes. We started to be really scared and to wonder which kind of options we could find and where also. So I did start again to research on the web. I bought books about immunotherapy, about this disease. I sent maybe 100 mails to specialized center, hospital all around the world, even again in France, to ask what else they could offer instead of this chemo dacarbazine. I found that one of the biggest specialists of this disease, treating only OMM, is Dr. Sato from Jefferson Hospital in Philadelphia. I did everything to find his contact. I sent mail to him, to Jefferson Hospital, and luckily one night Dr. Sato himself replied to me, asked me a few questions, and told me to be in touch with his coordinator the day after, which of course I did at once. I met an amazing lady. I would never thank her enough the way she has helped us during that time. So I sent the entire medical file to Philadelphia with the CD of images, everything they needed to know, everything to be able to give a second opinion. And just few days after the report came, and they were advising for a loco-regional treatment, one called radioembolization, called also SIRT treatment or Y90 microsphere, and combined after with the B immunotherapy, the ipilimumab and nivolumab. So the question now was where my dad, could have this treatment done. US was not an option at all. Without any health insurance, it's impossible. We can't afford the prices. And also my dad is actually not speaking in English, so it was not easy, even where we were in India, for him to be treated only in a language that he could not understand properly. Oh, and I forgot to say that in India, the SIRT treatment that they advised us was not available. SBRT was possible, another kind of radiation, but not the radioembolization. And for the immuno, it was possible there, but a bit complicated, and we have to import the ipilimumab medicine. So I decided to search again where in Europe my dad could go, and I found the contact of another specialist, the Professor Michelin. And I wrote to him again, explaining all our stories since the beginning, and asking him if he would agree also to look at the medical file of my dad to give us his opinion. So he agreed also very nicely and free of charge, same as Dr. Sato actually. And when the report came from their tumor board, it was the same advice, to do this SIRT treatment followed by the B immuno. So I straight asked him if he was ready to welcome my dad in his service. So we flew from India to Switzerland within 48 hours. Our oncologist in India advising us not to waste time, that it was the best option for my dad. We reached Lausanne, and it was a new chapter of this journey starting from there. All the medical team in CHUV Lausanne was so nice, so welcoming. It was a big relief for us to be with them, knowing that my dad would be able to start a treatment. It was giving a lot of hope, actually. But now one more problem was coming up in front of us. It was medical insurance, because we were not Switzerland resident. We don't have any medical insurance there. So how we could afford those treatments, which are possible in private, but which are like exorbitant cost. So from there I started to research again. I knew that there was some agreement between European countries, so this is where I started, and I found a law which were saying that when in France they can't propose any treatment when it is for a disease which has no cure, if there are any other available treatment in European countries which could give actually a better benefit risk, in that case the French government will pay for it there. So this is what I did, building a file for that and claiming to the public system in France to pay for the treatment for my dad in Switzerland. It is a complicated procedure. I would say it's adding one more fight when it's already very hard to fight a deadly disease. But we knew we didn't have any better option. We knew that this treatment was the best option for my dad to get a good response, to gain time. We are also lucky because my dad is a lawyer, my two brothers are lawyers, and this is also helping us a lot in this matter of administration procedure, the legal system, what we can access, how to do it. But of course the disease could not wait, and for the moment we had to pay everything from our pocket for my father to access the treatment. So he did the third treatment in May 2019 and June 2019, one on each lobe of his liver. The procedure went well. He of course had some side effects, but very manageable. He had some nausea, loss of appetite, but roughly after a month he was already feeling much better and had again a good energy and a good appetite. So the medical team decided to put the immuno on hold, and my dad was having weekly blood work to check his hepatic enzyme. Unfortunately, it was playing little like a yo-yo. It was coming down, but again going up, and even if it was not crazy high, it was not something normal. At the same time, my dad was having regularly the MRI checkup, and it was showing a stable disease. No growth, no new tumor, which were already good, and my dad was feeling great, with good energy, good appetite. He even started to work again, which were very good for him, very good monthly also, giving him again a lot of strength. Thankfully, he did recover from this huge infection, even if it took him a while to gain weight again, to get back some strength. But at the same time, his hepatic enzyme was not coming back to the normal range, and the doctor still could not understand what was the reason. So they decided to do one more biopsy, this time of the non-tumoral part of the liver. And this is how they saw that he has developed what we call an hyperplasia nodular regenerative, and it was most probably due to the radioembolization treatment, one of the side effects from it. It's a rare one, but it can happen, and it did happen to my dad. So they asked to some other specialists, immunologists, hepatologists, what they think if my dad tries B-immuno. And they all think that it was possible. So when there would be again a disease progression, this was the plan to finally start this immuno. I've searched also for some other option instead of this immuno. I've checked the clinical trials available nowadays in Europe, but actually I couldn't find anything interesting for my dad at this stage of the disease. We have really less clinical trials than in US for this disease. So my dad decided to take the risk, and he got his first infusion of Ipi/Nivo last week. He already started to develop some side effects, some skin rashes, pretty strongly apparently. But let's see, the medical team is doing a very close checkup on him. He has weekly blood work, weekly medical consultation, and we trust them a lot. We know also that they are used to control those side effects, so we are hoping for the best. Apparently, doctor has noticed that when you don't have any side effect at all from the immuno, it would say that it's not working on you. At the same time, it's not because you have side effects that the treatment is working. So for the moment, we have no idea, not yet. Doctors can't predict in advance actually on which patient this immuno will work or not. So we are hoping he can get his second infusion at least. We know that it is 4 infusions maximum, but that many patients cannot go till the first one due to the side effect. When you have side effects of grade 3 or 4, you might have to stop the treatment. But we also know that sometimes even having 2 infusions can already give a response. So we will see. So this is where we stand today, and it's been now 22 months that my dad has been diagnosed with liver mets, where he was given only 3 to 6 months in front of him. I don't think any doctor can predict the end this way, you know, unless you are at a very terminal stage of a disease. It's very important to have hope. Yes, we know there is no cure today for this disease, but they start to understand how works the disease better and better. There are local regional treatments available in a few European countries, and those treatments are working pretty well on many patients. And even if it cannot cure, it can give you time, it can make you gain time with a good life quality. And it's so important, you know. Within the 22 past months, we could have great time in family, we could even travel, and you know, this time has no price. It was so important for us. I'd like to say also that it's very important to be in the hand of the right medical team. I mean by that, in the hand of a specialist who knows this disease. OMM doesn't work like the other cancer. It doesn't even work like skin melanoma. And it's very important to be with a doctor who knows the treatment available today, and even by which one to start with, because this can make a difference. I would never thank enough the team of Professor Michelin and Professor Denis from CHUV Lausanne. They have been so supportive, so professional. They are next to us for each step in the fight. They are never giving up, always giving us hope. And this is so important. I wish the same for all patients. One more thing that I discovered quite late in our journey, but which can be a great help for patients as well as for caregivers, are the private group on Facebook. Private group only with people having this disease. It can be a great support, and we can also get a great amount of information about the disease. And last thing I'd like to speak about is the accessibility on the treatments. I know it's a big problem in Europe for many patients. Not all European countries can offer the same treatment. As I was saying, in France it was impossible to access the local regional treatment. It's even not possible also to have the B immunotherapy. They give only the single one, and we know that this one for OMM has almost no response. So as I said, it is one more fight, and it's something crucial actually. So recently we discovered also, at least in France, there is this law which says that when you are retired, you are allowed to go to spend time or even to live full time in another European country. And in that case, you are allowed to transfer the medical system in the new country where you are living. And even if Switzerland, for example, is not a European country, they sign for this agreement. So this is a procedure that we have also started for my dad, as he is now retired. So we are in the middle of the process for him to transfer his medical health insurance to Switzerland. We will see how it works, but apparently it has also a great chance, and in that case the immunotherapy would be paid by the health insurance because the B immunotherapy is a treatment which is giving for this disease in Switzerland. So I know this is something very, very complicated also for all patients, but it might worth it to check exactly the laws in your own country, to see the agreements within Europe, and see which other treatments are available in different countries when yours cannot offer you anything. I wish the best to all patients. I know it's a very hard fight against the disease, but don't give up. There is hope. Bye-bye.